Thank you, Beth. You know, we all hear about these tariffs, and when we hear it from you, it's real, especially when you got 5 people on payroll. So we don't take it lightly. Thank you. The next speaker, Bethany Greiner. Bethany Greiner has been a job coach and paraeducator for 14 years. She has previously worked in long-term assisted living for adults with severe to profound disabilities. She helps care for her father with a disability and health problems who lives with her family. Bethany was previously a single mother who briefly relied on medical assistance. She has been a resident of Minnesota for 29 years. She will be discussing Medicaid cuts and how they will negatively impact long-term assisted living, schools, caregivers, taxpayers, low-income families, expectant mothers, the elderly, and the disabled populations. Now, you may have seen that there is a new author in the Overly Tribune who's putting out letters on a regular basis. That's Bethany Greiner. She has gotten involved, so this is not the only thing she does. She comes to meetings and she's getting really involved. I've asked her, maybe you should run for office. She said, yeah, she might think about that. So, all right, Bethany.
Hi, everybody. I don't do a lot of public speaking, so I brought paper with me. I hope that's okay.
Of course.
But hi, my name is Bethany Greiner. Today I am speaking about the Medicaid cuts in the 1,000-page bill that just came through the House of Representatives today. You might have heard about it, the One Big Beautiful Bill Act. They voted on it this morning. They started meeting about it yesterday at 1 o'clock in the morning. I previously worked as a caregiver for disabled adults in assisted living. Some of my clients came from the old state hospitals where they were traumatized by the abuse and neglect that they suffered there. Many patients were restrained in straitjackets, shackles, or chained to their beds. They had no life-enriching activities. They didn't go to school. They got very little medical care. My clients remembered being showered with fire hoses. They were forcibly sterilized so that they could not pass on their defective genes to their children. They were dehumanized. They were given no respect and no dignity. This happened in my lifetime. Thanks to the integration movement, the old state hospitals were closed. Medicaid helped disabled people integrate into the community, attend school, find work, have families, and pursue happiness. Medicaid cuts place the entire caregiver industry at risk. Nearly 4 million people work as PCAs, personal care attendants. We have over 65,000 long-term care facilities that employ over 3 million people. Medicaid cuts now threaten to close those facilities, and we will lose many of those jobs. 71 million people rely on Medicaid for their medical expenses and services. That's the combined population of our 2 biggest states, California and Texas. It covers low-income families, pregnant women, the elderly, and the disabled. They are all at risk of losing adequate health care. People with disabilities will struggle to get therapies or have PCA service, live in assisted living, get assistive devices, or even mental health support. Medicaid cuts damage their ability to work, to live independently, and to have healthy, happy lives. I used to be on Medicaid. I was a single mother, and I was injured in a car accident. I broke my pelvis, and I spent 2 years on crutches. I could not work for the first year and a half of that. And it took 2 years for the money to come in from my insurance company to help pay those bills. And doctors and physical therapy, they don't like to help you if you can't pay your bills. If I did not have Medicaid, I don't think I could have paid for those bills. I now work as a paraeducator and a job coach. I've done it for 14 years. I teach work skills to students with disabilities. Most students that I serve will go on to find jobs, attend college, or get certified in a trade. They will be productive, tax-paying citizens. School districts get paid by Medicaid for the expenses incurred by the services that they are required by law to provide to our students with special needs. The Medicaid cuts will not cancel the requirements of the law, so schools will have to find other ways to pay for the services we provide. School funding primarily comes from national funds, state taxes, and property taxes. When we are cutting money from the Department of Education and we are cutting Medicaid cuts, we will still pay for those services. We will pay for them with higher state taxes and higher property taxes. And schools will try to meet us in the middle. They will trim their budget. They'll trim their budget from things that aren't legally required, things like sports and extracurricular activities and smaller class sizes. It will impact all the students and all the staff. Or we could lose the services altogether. They want to move special education out of the Department of Education and under the umbrella of the Department of Health and Human Services, headed by Robert F. Kennedy. He doesn't think that we should have those services in school at all. He says they're not academically required. He says parents of disabled students, they should get those services outside of school, pay for it out of their own pocket. How many parents do you know have the time and money to do that? When families can't afford to pay for their loved ones with disabilities, if they can't get PCA help at home, and they can't afford the services that their family members need, those people will be at risk of going back to state-operated facilities. They'll lose their independence. They may not learn life skills. They may not learn work skills. Don't these people deserve their constitutional right to life and liberty and the pursuit of happiness? I believe that all people deserve to be treated with dignity and respect. We've made so many steps forward, we should not be going back to the way it was. The One Big Beautiful Act was amended just this week to mandate work requirements for Medicaid benefits. This requirement seems to ignore the fact that 64% of working age adults on Medicaid already have jobs. It remains to be seen how exactly those requirements would impact the babies, the disabled, the elderly, the mentally ill, the caretakers, and the pregnant population who are not able to work while they are on Medicaid. Financial experts do not support the work requirements. They say it costs more to enforce the work requirements than Medicaid would save by enforcing them. MAGA Republican-supported laws are infringing on a woman's right to choose with her body what she does, even after she dies now. Yeah. I'm sure you're familiar with the recent example in the news of Adriana Smith. She's a woman in Georgia who was declared brain dead while she was 9 weeks pregnant. Against medical advice and against the wishes of her family, she is being kept alive on life support until her baby can be delivered. Doctors say the baby will probably not survive, and even if it does, it will have significant health issues. The family is being financially responsible for the bill of keeping her alive to try to save this baby. And if the baby does survive, they will be further liable for the medically complex problems the baby will have for its entire life. When lower income women do not get to choose whether or not to have babies, they and their families will also be forced to pay for the medical bills when Medicaid no longer covers them. And remember, MAGA wants us to have lots and lots of babies. They're willing to pay us $5,000 to have a baby. If you have 6, you get a medal. Just for reference, the average cost to raise a baby to adulthood is averaging $400,000. Medicaid currently covers 42 out of 100 pregnancies in the United States for low-income mothers. The cost of the hospital births alone could be $40,000, and the loss of Medicaid coverage for maternity care would result in mothers getting less prenatal care and worse health outcomes for the mother and the baby. In plain English, more mothers and babies will die. Medicaid cuts do not seem to align with the goal of encouraging women to have more babies, does it? Rural health care is already struggling to survive. Hospitals that rely on Medicaid for funding are at risk of closure from the cuts. Longer travel times to reach critical medical care would hurt not just expectant mothers, but everyone who needs timely health care. Albert Lee knows what it feels like to lose the baby place and to lose our many hospital services from our Mayo Clinic location. We know what it's like to wait longer for appointments. We have less doctors here. Do we want to know what happens to our town and the healthcare in our community if we lose our hospital altogether? Coverage for prescription medications would be impacted. I don't know how many of you have seen the out-of-pocket costs for your prescriptions, but they are sky high. Without insurance, people will not be able to afford their medication, even if they would die without it. Some people try to keep paying for it. They skip their house payments and they go bankrupt. They lose their homes. According to the American Journal of Public Health, medical debt is the #1 cause of bankruptcy and the subsequent homelessness that comes with it. The National Bureau of Economic Research reported that people without medical coverage are 21% more likely to die in that given year compared to their peers who are on Medicaid. Brad Finstad and his fellow Republican politicians in Washington support Donald Trump's budget cuts of $880 billion from federal Medicaid programs. They justify the cuts by claiming that there is massive fraud and waste and abuse. But the math just isn't mathing. They claim to be kicking 1 million illegal immigrants off of Medicaid, but they are cutting 14 million people's coverage immediately and banning them from getting their own coverage through the Affordable Care Act exchange, so they can't get any insurance. Millions more will lose coverage over the next 8 years. Republicans in Washington claim to have identified $50 billion in waste, fraud, and abuse. Even if that was true, how does that justify cutting nearly $1 trillion from Medicaid? How does that make sense? Make it make sense. So why do they want to cut all this money from Medicaid? These cuts won't pay down the budget deficit. They won't lower your federal tax bill. It doesn't even take money from people who don't deserve it and give it to people who do deserve it. They're robbing the poor to cut taxes for the rich at the cost of human lives and suffering. The One Big Beautiful Bill Act has shamefully made it through the House of Representatives this morning. They passed it through the House of Representatives. It heads to the Senate. Medicaid cuts would result in a lower quality of life, increased health risks, destroyed futures, and the loss of independence and dignity for vulnerable American citizens. It would separate families, eliminate millions of jobs, close hospitals, increase bankruptcy and homelessness, and more people will die needlessly. We know that Brad Finstad supports these cuts because he voted yes to the One Big Beautiful Bill Act.
Ooh.
By the way, it passed by 1 vote. Had he not voted for it, it wouldn't be going on to the Senate.
Well, but he represents us.
Oh, I know. He's here to hear our problems and accept responsibility for them, right? If you don't want our elected representative to support these policies, we need to vote out Brad Finstead in the 2026 election. We want someone who will do the job. We need someone who will meet with the people they represent. Someone who will listen to us and fight for us. Thank you.